to the So You Want to Work in Healthcare podcast. I'm Leigha, I'm your host, and today we have Bryanna Vesely. She is a DPM MPH, a podiatry fellow at the moment. She's currently in a foot and ankle fellowship in advanced reconstruction and sports medicine. So welcome, Bryanna.
Thank you for having me. Nice seeing you now.
You're welcome. I know. So this is our first time meeting. We actually met on TikTok. I'm excited to have you because you are currently in your fellowship, like I just said, but I think that gives our viewers and listeners a good insight into what fellowship is like, what residency was like. You know, you're like fresh out of residency, right?
Yeah, I ended residency end of June, so I'm very fresh right out of it. I still feel like I'm a resident a lot of times. I'm like, oh, I'm going to go to the resident room and see my friends. And then, nope, sadly, I'm done.
But so close to being done and on your own.
Very true. Yeah, finally we'll make like legit doctor money and operate all by myself. It's going to feel so good.
That's awesome. The first question that I like to ask everybody is why medicine? Why did you want to go into healthcare? Do you have a story? Do you just want to help people? Like what was your reason for going into medicine?
Yeah. So I was a ballet dancer. I grew up at Ballet, Virginia. So I was very hardcore. It was like you go to school and then my mom picked me up from school and we drove to the ballet studio and I did that every night of the week, every weekend. Starting at age 10, I went away to summer intensives. So it was definitely my life and what I wanted to do after high school. Sadly, I got injured and I ended up having a hip scope. And I was able to dance afterwards, but not ballet into like the level of ballet that I wanted to do in order to go professional. So that was definitely hard. And so I wanted to do a career shift and I just had a hip scope. So I knew about orthopedics and then I started shadowing, changed my major to pre-med in undergrad. And I literally cold called all these different healthcare professionals because I didn't know anyone in healthcare. So I cold called like MDs, DOs, and then at that time, I didn't know podiatry was its own school. So I just saw like a doctor's office for podiatry and said, hey, can I come shadow you? I actually saw the guy shadowed at a conference this year. And I was like, oh my gosh, like I did it. I went to school. I went to residency. So luckily,
that's awesome.
Yeah, it was so good getting to see him. So luckily, his name's Dr. Wild, and he like let me shadow, and he was very happy. A lot of people in medicine, I think, aren't super happy, which makes me feel really bad that he went through all that school and then aren't happy. And there was a lot of different types of like MD and DO specialties that I was going to be unhappy with if I ended up matching. So for me, I shadowed this podiatrist and I ended up doing like a weekend podiatry thing at Temple where you shadow a whole bunch of different podiatrists. And I was like, all these people are happy. They have a good work-life balance. I was like, this is super cool. I'm used to bloody feet from ballet. Like, let's go. Let's do podiatry.
Oh, I love it. Actually, we have something in common. One of the first doctors I shadowed was a podiatrist.
Really? Oh my gosh.
Yeah. And it was also random. I like cold called and just showed up at doctor's offices to get my shadowing hours. And he was one of them. I think he just happened to be in the same building as a cardiologist that I wanted to shadow. And right away, he was just so cool. He was like, yeah, when do you want to start? Like, come by tomorrow. And I ended up spending a good amount of time with him. And I got to see a surgery with him as well, which was really cool. I did pass out when he took out an ingrown toenail. And I was like, oh no, is my career in surgery like not a thing? But we got over that. But I love that you cold called doctors and providers because I was just talking with another PA who I had on the podcast and she did the same thing. And you probably get DMs like this all the time because I know I do. And people are asking, how do you get patient care hours? How do you get your shadowing hours? Like, can I shadow you? And I just tell them I just showed up to doctor's offices. I mean, I think it's the best way.
Mm-hmm. Yeah, like I know some of my classmates, like they had a family member in medicine, so they would just hit up like their family friend or their dad's like coworker. But for us, like if you don't have someone in medicine, you just start calling, and hopefully there's doctors that are cool enough that let you come.
Yeah, and I'm sure I feel like there always will be at least one if you call enough
Oh
people
yeah.
or show up to enough offices. So back to why you got into medicine. So basically, you were a dancer and you had an injury which led to surgery. I don't know if you had a good experience or a bad experience with your healthcare providers, but either way, I see a trend with people and injuries and then wanting to go into medicine. Same with me. I was a soccer player, always injuring my ankle. So
Oh yeah.
I had a similar course.
Definitely.
That's also why your TikTok is called the Dancing Foot Doc, right? Is that
Yes,
right?
it is.
Yeah.
Yeah. I don't
I
do as
love it.
many TikTok dances anymore, but when I first got TikTok, like pandemic wise, like TikTok dances were really fun.
They were. I feel like it's fallen off a little, but you can still dance.
Yeah.
So, why feet? Why did you decide to go into podiatry? I know you touched on it before, like you got to shadow a podiatrist, but I'm sure you at some point saw other aspects of medicine. And was it really just that one doctor that kind of inspired you? Was it foot injuries yourself, or what was it?
My ballet school growing up, we had like a specific podiatrist, and all of us kind of went to him if
Oh,
we had a foot and ankle problem. And there's definitely like very ballet specific injuries. There's even like a fracture called a dancer's fracture. And so it's very common for like my friends to go to this podiatrist. So I've known about it, but I never needed like a foot surgery or anything. So it was really this podiatrist when I was shadowing, and I shadowed like family medicine, and I was like, oh gosh, like God bless those people, but it's just not my personality to do something that's not surgical and not super duper hands on. So podiatry, I was like, oh, I get to use my hands like all day during clinic, whether or not it's injections, doing procedures in the office. It's never boring. And then the guaranteed route to surgery. There's no other way to be guaranteed to get to do pretty cool surgeries except for podiatry. And
cool.
one thing that like people don't think about is like length of surgeries. And I know you're in the OR, so you get it. Like it sucks. Like
Yeah.
on off service rotations, if you're in like a 7 hour surgery, like that, I don't want to do a 7 hour surgery. Like podiatry is
My
perfect. It's
goodness.
like 2 hours or
Yeah.
less is like most of your surgery. So enough to do something really
Yeah.
cool, but not enough where you're like crippling walking out every day.
Yeah, no, that's a big deal. My friends and I were just talking about this because I feel like with orthopedic type surgeries, it's kind of rigorous. And
Oh yeah.
a lot of the techs that I've worked with over the years, they all have these work related injuries. And I hate to say it because I love the OR and I love ortho, but it takes a toll on your body and I feel it now. I'm like 12 years into my career and I feel it more and more. And it really, besides the grueling aspect of having to be in the OR for 7 hours, it's really nice to just kind of get in, do what you need to do, get out within a 2 hour time frame, and it's better on your body. So I totally understand
Yeah.
that.
Like doing a
Yeah,
2 hour case and then getting to go and like sit for a second and then go back in. Oh my gosh, that's so much fun.
right. I love how passionate you are about it.
Oh yeah,
I
I love
love
it.
this. So, how long is podiatry school? What is the process? Because, like you said, you didn't really podiatry didn't seem to be on your radar back when you were in college, and I don't know if it's on that many people's radar. Even as a pre med student, it wasn't when I was pre med. It wasn't really something I thought about until I shadowed this guy. So, tell us about schooling and how it goes.
Yeah, it's sadly like not very well known. We had our dean when I first started podiatry school. His name's Dr. Harkless, and he said it was like the best kept secret of medicine. And I do agree with that, even though it's kind of cheesy. So you do a bachelor's degree, you take an MCAT, and it's all the same prereqs as the MD, DO, like more traditional route. Podiatry school is 4 years. So I went to Western University. It's in Southern California, and our curriculum was a combined curriculum with the DO school. So that meant like we took every class with the DOs except for their osteopathic manipulative medicine. We even took
Okay.
OB-GYN. Like we really took every single class with them. And then when they would take their osteopathic manipulative medicine class, we would take our podiatry focus class. So that's how ours was set up. So just like an MD or DO school, it's 2 years of didactics and then 2 years of clinical rotations. So 4 years total. And then your clinical rotations are everywhere from like gen surge, plastics, obviously podiatry, family medicine. I had a woman's health rotation. So you're really getting like a pretty full education. So then after you get your DPM, you do either a 3 to 4 year residency, and then after your residency is an optional 1 year fellowship. And all
Okay.
podiatry residencies are surgical. Um, every residency is kind of like a different level of surgery, but everyone is a surgical residency.
Oh, wow. I didn't realize that. So it's very similar to the med school residency fellowship path of, you know, it in regular med school. I don't know what to call it,
Yeah,
but
yeah,
you're
it's like
basically it's the same. You're just focusing more on feet.
yes, yeah. And you go in and your match day, you know you're matching into podiatry. So it's like, okay, I know what type of doctor I'm going to be, but you're
Yeah.
still wondering on match day where you're going to match. Um,
Right.
but
Right.
I remember, so I was a COVID match kid. And so we were all of our DO, DPM friends. We had big plans. We had to make it obviously a lot smaller. But some of my friends were like opening up their letter and wondering, oh, I'm going to be this type of doctor. When our little group of
Right.
podiatry that was there, we knew we were going to be podiatrists. So a lot less stressful for us. It was just, well, where are we going
Yeah.
to move to?
I bet. Yeah, that makes sense. And can I ask if you know how much on average does podiatry school cost?
Yeah, it was actually less than the geo curriculum for some reason.
Okay.
I ended up being about like $250,000 in debt, and that was just from podiatry school. I want to
Oh,
say
wow.
it's about like 40,000 ish a year for the actual school, but then it's like you have the living expenses and all of that, so you end up
Right.
wrapping up more.
Yeah. Wow. It's so expensive. It's all so expensive. Med
Gosh,
school, PA school, all of it.
yeah,
It's
it's
crazy.
so depressing to
And
look
I can
at.
I know. I can relate to the loan thing though, because I did it for 10 years, but luckily I just got my loans forgiven. So
Good for you. That's
it
so
goes fast.
exciting.
Yeah, yeah, it was cool. I'm lucky, very lucky. Okay, so you said before the prereqs were pretty much all the same as they would be for med school.
Correct.
And do you know about how many podiatry programs there are in the US?
Yeah, there's 11. They
Oh,
just
wow.
opened up
It's a
two.
small
So when I
number.
was going through, yeah, there's only nine, and there's only between, I think it's only like 400 something podiatry students graduate a year from all the schools combined.
Wow.
So we're a tiny field. Like I think
Crazy.
that's why people don't know about podiatry, and we all know each other. Like it's so weird.
Yeah.
We go to
Yeah.
conferences and like everyone knows each other. It's like one person removed.
Right, right. Wow, I had no idea it was that small.
Yeah.
That's
Baby
crazy.
field.
Baby feel. We need
Hmm.
more because I'm
Yes.
always telling people to go see a podiatrist.
Yeah.
Wow.
And there's so
I
many
think there's
jobs right
one
now. Like I feel so
really.
lucky to be on the person about to graduate side, not the job side, because there's so many good jobs out there for us right now, and not a ton of us
That's great.
residents graduating each year.
Wow, yeah, I mean that's such a good reason also to just to go into a certain field is job openings and also the lifestyle like you said before. Um wow, I'm still like taken aback that there's only 400. You said 400 graduating students a year?
Yeah, my class had 38
Oh
graduating.
wow.
Yeah. So we
Amazing.
knew each other great.
There's a podiatry school in New York City, right? I think I
Correct.
see it. I've seen it. Yeah.
Yes. Yep.
I used to go past it on the train all the time.
Yeah. One of my co-residents, he went there.
Oh, really?
Hmm. Yep. So, but yeah, only 11 and two are like brand new. I don't even know if they've had a full class graduate yet.
Wow. Do you know how many women are in podiatry? Is it mostly men or is it half 50-50?
It is more men than female. I was looking this up and it seems like about a third of practicing podiatrists are female now, and it's been going up
Cool.
a lot. I was looking on the like American College of Podiatric Medicine page, and now it's about 50-50 in classes. But like practicing
Wow.
wise, it's about a third.
That's great. I love to see it. I know
Me
that
too.
at least the last time I checked, there are more and more female or women orthopedic surgery residents too. And it just in my hospital, we have a decent sized residency program. And over the last 5 years or so, it went from maybe like one or no women a year to probably around two. I think there may have been three this past year, but yeah, it's definitely more common. We've had more women fellows too, which is really fun. So
Yeah,
I love to see it.
I think I'm the second female fellow at my program, I
The
believe.
second,
Yeah.
cool. Yeah. So your current situation, talking about your program, your fellowship is where? I mean, you don't have to say if you don't want to, but
It's in
where are you
Nevada.
doing your fellowship?
Yeah, it's in Nevada.
Okay.
It's at a ortho group, and we just do foot and ankle surgeries. It's great. Like I really love my fellowship. So it's 2 days a week of surgeries, 3 days in clinic. It's pretty good balance. I would say each surgery day is about 6 to 8 cases, and
Oh
we're
wow,
seeing
it's a good
like
amount.
everything. Yeah. So we put in one of the, I think it was the third talus replacement in Nevada. So that was
Oh,
like really cool
awesome.
getting to see. But we're doing like minimally invasive bunions to flat foot reconstructions to like ankle fractures, Liz Franks, talus replacements. We have a couple total ankles this week, so I get to see like
Awesome.
everything in fellowship. I love it.
That's great. I loved actually doing like assisting on foot and ankle surgeries back when I was right now I'm on hip and knee replacements, but
Okay.
back when I was like we called it a core PA, I got to do a lot of foot and ankle stuff. The flat foot reconstructions are nuts.
Yeah, patients
They're
love them
crazy.
too.
Yeah, they do well, right?
They do. Yeah, they're overall like very happy afterwards.
Cool. Cool. I think it took a little longer than 2 hours, so
Yeah,
if I remember
sometimes it does.
correctly.
Sometimes it does, which is
Yeah.
totally fine.
Yeah. I like to ask my guests what you love about what you're doing, your job, or currently your fellowship, and one thing or a couple of things maybe you don't love. So let's start with the things you love about being a podiatrist.
Yeah. I think our field in general, since it's small, and we are like pretty excited about it. We like sharing it in general. I think podiatrists are happy because you have pretty good work hours. It's not a surgical field where you have to take call in order to like be successful and make good money. I know a lot of podiatrists that don't take call and they make really good money. And the surgeries are just cool. Like helping someone walk, I don't think people realize how much your life revolves around walking and being on your feet and not having foot and ankle pain until you have a foot and ankle pain. You're like, oh my gosh, my life is drastically like decreased in quality. So getting to see
Yeah.
these patients, it really improved. It's huge. Um, so that's probably my favorite parts. I've also loved how our field's been growing since I've even started, which I started school in 2016. So I've only been in the field for that long. But more research is coming out, more podiatry residencies are growing. It seems like more people are starting to learn about podiatry, but I think or in general, our field is getting better and we're having more recognition. Um, so the
That's
worst
great.
things about podiatry.
I
um,
mean, if there are none, it's okay, but
no, there's
just maybe.
definitely some. So one thing is like with being a small field, half the time people think we're pediatrics. They're like, "Oh, that's so cool! You're a kid
Oh.
doctor." I'm like, "No,
Hmm.
like we see some baby feet, but not really, not that much." And then also, I think there's a lot of like, I'm sure you experience it, internet trolls who don't quite know what your field is. And so we'll get stuff like, oh my gosh, you just trimmed toenails. Like you're $250,000 in debt to trim toenails or be like a glorified pedicurist. And
uh,
yeah, and there's just the like misinformation out there. But
Yeah.
then you go out in the real field and you're in a hospital and you're very well respected. So it's just more internet people just being uneducated.
Yeah, I can definitely relate to that, especially
Yeah,
being a PA, because there's still a lot of people out there who don't know what a PA is.
totally.
So I'm constantly having to explain that, which I'm happy to educate people about. But when I refer people to podiatry, they usually ask, like, "Oh, is that what is that?" Or who, what kind of doctor are they, whatever. So I think there needs to be more education online or on social media, which is probably part of the reason why you're on social media, I would assume.
Definitely.
And I think there's actually some pretty successful podiatrists on social media, which is very
Yeah.
cool.
Yeah, there are. And yeah, it drives me crazy. It's like, no, we really did not go through 7 years after undergrad to trim toenails. Like, I promise
Yeah.
you, like, trimming toenails is important. I get it. Like, but
Yes.
we do like ankle replacements. We can do crazy fractures, deformity corrections, like put frames on. Like, we can do all these cool things. But yeah, we can also trim your toenail, but it's more than that. You know?
But often like life-saving surgeries and treatments, and
Yeah,
feet are so important even when it comes to just medicine in general. Take out the surgery part. I learned so much on that rotation with the podiatrist, just about like diabetes and
true,
um, like peripheral vascular disease and things like that, and how often the first time you might be the first doctor they see
true.
for a even bigger issue, which I think is super important.
Yeah. There was so many studies published about patients who are diabetic who see a podiatrist, their risk for amputation significantly decreases. And then they also saw that patients who see podiatrists versus don't in a Medicare population, they were first off less likely to get an amputation, but also seeing a podiatrist greatly decreased the healthcare amount of money that was spent because either
Oh,
their
wow.
amputation was caught earlier or it was less proximal of an amputation. And there's been so much research about like if you have a below the knee amputation, the 5 year mortality is higher than most cancers. So I know like
Yeah.
people are like, oh, I'm losing a toe, or like, oh yeah, I'm like, it doesn't really matter that much about foot health. But when you think about that, like you lose a leg, your mortality in 5 years is higher than a lot of cancers. Like that's a mind blowing statistic for me.
That is a mind-blowing statistic, but I kind of believe it.
Definitely.
It's sort of like, to, I guess, the statistic of how when someone breaks their hip,
Mhm.
if they're over a certain age, their mortality rate goes like way up.
Yeah,
So
exactly.
it's just like kind of like losing the or not having the use of something that was so important, or that you just are used to. And yeah, it's interesting how that happens, but
Very
those
true.
are such important statistics.
Yes, yes. And hopefully just more people start doing preventative care because it is so important for, look, I'm obviously see the foot perspective, but for all types of medicine, preventative care is the big push these days, and that's what it should be.
Yeah, for sure. For sure. But also cool that you get to do all those surgeries.
Yeah.
Also total ankles. I'm
Hmm.
like that. I feel like when I first started, it was really rare to see someone getting, like 10 years ago, someone getting a total ankle. And now our hospital does them like every day.
Yeah. Yeah. It's been around for like decades, but the older generations had such poor results and like the survivorship was very low and everyone was like having to convert into a fusion. And now these newer generation ankles are doing so well that it's becoming a way more popular procedure. It's just not every ortho foot and ankle or podiatric surgeon does them. So it's finding like a person
Okay.
that does it in your area too.
Got it. Okay. That makes sense. Is there anything that you feel like you would have done differently with your career so far?
Um, So far, I don't think so, but I think that's just because I'm just now starting. Like,
Yeah.
yeah, but I'm like very happy. I went to Wake Forest residency and I'm so happy with that. Like, I felt like they gave me well rounded training and then I have lifelong best friends. And my mentors, I
Cool.
still bug like 24/7. I'm like, hey, like, what you
That's
doing? Can
great.
I get advice? So not everyone has that.
Yeah, and it's probably also because it's a kind of a smaller community. So I feel like you probably are so very close knit, maybe a little more than someone else
Very
in the medical
true.
field.
Yeah.
Yeah.
So far career wise, I feel like I haven't messed up, but
Good.
yeah. Now I'm in the job interview and contract negotiating. So maybe once I sign my
Okay.
contract, then I'll let you know if I did anything wrong.
Did you go straight from undergrad to I don't know if I'm saying this right, podiatric school?
Yeah.
Am I saying that right? Okay.
Um, I did not. So I was weird. I did 3 years of high school, and then 3 years of college. So I ended up being 19 when I graduated undergrad. And
Oh, wow.
yeah, so I was a baby, and I did get into a podiatry school right out of it, but I think I needed time a little bit. So I got a master's and did some research, and then I went when I was 20 to podiatry school. And so that's why I'm like a little bit younger for podiatry right
Okay.
now. So I
What
did
did
take
you
a
get your
gap year,
master's?
public health.
Oh, great. Cool. Wow, I had no idea.
Yeah, yeah. Like it's definitely not like necessary to get a master's, but I do think it's been a little helpful.
Yeah, I was just gonna say, like, how do you feel that public health master's has helped you or will help you?
I think it has helped with my research. I had a pretty strong passion for research at Wake Forest, and I still work on projects with them all the time. So I think having that public health background, we had to take the like stats classes, and we had to do some coding.
Right.
So sometimes I would do my own stats if I had enough time instead of using our stats department. And then just the overall like how to do a research project. That's where my public health background helped. But I'm hoping it'll help in the future, just me navigate the healthcare system. And if I end up working in a hospital, just understanding how it all works better.
Yeah, and I think it makes you even more valuable too to whoever you end up working with, especially
I
if it's a
hope so.
health system. Yeah. Um, oh man, you just said something that made me think of something, and I lost my
I
train of
hate it when
thought.
that happens.
What was it? Oh man, maybe I'll think of it in a second. That master's was a 1 year program.
It was 2 years. So it's five
Okay.
semesters, and I did 3 semesters before podiatry school. And then I ended up finishing my last 2 semesters online during my third year of podiatry school. Yeah, I would
Wow.
not recommend that. That was
How did you do that? Yeah, I was gonna
not a good
say.
idea. I would like go to rotations and be exhausted and then have like an essay due. And then I'd go home and like, oh, I guess I'm going to type my essay all night. So I would not
Wow.
recommend doing that route. Just do
Right.
like a 1 year master's if you're going to get it, not like be
Mm-hmm.
full time MPH student and DPM student. That was not the best idea.
I was gonna ask. I figured it out as you were talking, but I was gonna ask what the MPH stands for. So,
Oh yeah,
Masters in Public
master's
Health.
public health.
Cool. Well, that's really different. And I mean, I wish I took a gap year. I was just talking about this with someone, and I didn't. I went straight through. But I think it's really important to if you're feeling at all if it's, as a student burned out or you just need a little more time, like it's okay to take a gap year. I think like
Yeah,
it was drilled into my mind that I needed to just go to school and finish as fast as possible so I can start paying my loans. But it's okay. You can put those loans in forbearance for a little bit
yeah,
and you'll deal with it later.
yeah.
It's probably my only regret is not taking a gap year.
Yeah, I definitely felt like I needed the gap year. I also was just so young, like 19
Yeah.
to start going to like a doctorate program would have been I felt like too young. So it was good for me to have a little bit of time to hang out with my friends. I moved back home during my master's and hang out with my friends from high school, do my master's program, do research and make sure like podiatry is 100% what I want because I'm going to be doing it forever. Like never planning on stopping until I'm
Right.
really old.
Yeah. How did you do high school in 3 years? Was it just an accelerated program?
Yeah. So I wanted to join a ballet company, so I just worked with my counselor to graduate early.
You're a legit ballerina.
Yeah, like all my friends from my ballet school are real dancers. And then I'm like $250,000 in debt. Hello.
Listen,
Yeah.
you're doing big things over here,
Yeah, it's
so it's
fun. Just
all
a different
good.
type of fun. It's nerdy fun.
We actually take care of a lot of dancers being in New York City, so I have
Oh,
a
I
lot of
bet.
experience with ballet dancers and hip problems.
Yep, I get that.
Yeah. So, if you don't mind, if you want to just talk a little bit about your surgery, because I mean, personally, I'm interested because I do hips. Well, I assist with hips and knees, and we used to do a lot of hip scopes, but we stopped. And it's, I think, partially because my boss wanted to just really focus on arthroplasty. But I have to say, the outcomes were kind of 50-50 with hip scopes. So, what was your
Yeah.
experience?
Yeah, so like working with dancers and any health professional working with ballet dancers, like we don't like to stop. Like we'll work through any type of pain.
Yeah.
So I really tried doing that for a while. And then what really made me, I had like rounds of injections. So I was getting the steroid injection, trying to dance through it. But it ended up being every day I was having pain in my hip just going to school. I would be sitting in
Mhm.
class and I'd have that deep pain in my right hip and I tried to readjust and like I couldn't get it out.
Yeah.
Um, so I had the hip scope for my labrum tear and it did well. Like I do not have like chronic hip pain like I was having then. So I can
That's great.
do, I can go to the gym, I can do leg presses, like I can do all that stuff. But the concept of ballet, like holding your leg in the external rotation, not just like kicking it in the air,
Mhm.
that never felt quite right. Um, but I was able to do dance team in college still. So it just wasn't like a
Okay.
ballet thing. So at Virginia Tech, I was on a like club dance team. So we did kind of all styles. And then in my master's, I was on like the dance team for football and basketball at a D1 school. And that was really
Cool.
fun. So I still got to dance. So I would say like overall, I thought the hip scope was a success. Like I got to be a
Good.
D1 collegiate dancer on the dance team. And I think that like good job to that surgeon. I
Yeah.
just couldn't do the ballet part, which is very understandable. Like it's so bad for your hips anyway.
It really is so
Yeah,
bad for your hips, but I'm glad you still got to dance and go further with it.
yeah,
So that's great.
yeah,
Good. What I want to wrap up with is I'd like for you to give our viewers and listeners one piece of advice about podiatry school or getting into podiatry school, or any piece of advice regarding what you're doing regarding podiatry and the path to it.
yeah. I would say shadow a ton. I love podiatry, and I think it's the best kept secret of medicine. But I know it's not for everyone, and I don't think it should ever be someone's backup plan. Like I didn't get into an MD school, so now I'm going to go into podiatry. Like you should genuinely want to treat people's foot and ankle conditions because it's an incredible
Right.
field, not because it's your backup. So I want people in our field that are passionate and not just, oh, I didn't get in and this might be a little bit easier to get in. You're going to be doing it forever. So you better make sure you love it. I would also say shadow lots of podiatrists. There's older podiatrists that really run more of a diabetic routine foot care establishment. And it's
Mhm.
very important, but if you don't want to do that, there's tons of other routes of podiatry. There's podiatrists for sports teams. There's podiatrists that are doing tons of like minimally invasive, cool surgeries. There's ones that are doing big reconstructions. So it's a very big field for only being one body part. So if you're going to one and you were stoked on surgery and all they're doing is trimming toenails, like go see another podiatrist or vice versa. If
Yeah.
you want to do like clinic, you make more money in clinic. So if you want to like make a lot of money and have low stress and do nails and calluses and orthotics, like do that and don't be scared away when you see like these big reconstructions and hammers and nails and stuff. Like, okay, like you don't have to do that. It's okay. Um,
Right.
so that I would say just keep shadowing, make sure it's what you want. And then when you're choosing a residency, it's 3 years of your life. Like just go to the best residency you possibly can go to. Like if it means moving somewhere else, like just suck it up because you get 3 to 4 years of training ever. And that's your time to like build your mentors, build your network, like have that support system and learn everything you can and just gobble it up. Who cares if you're working terrible hours because that's when you're learning. I
Yeah.
definitely had like rough hours as an intern, but I also came out of residency feeling really good. And like, my two co-residents were 3 per year, they didn't do a fellowship and they're doing like whatever cases they want. And that's how you want to feel after a residency. So just suck it up, do the sucky hours, like have as much fun as you can during it, but that's your time to like learn.
Yeah. I feel like it's so important to just get as much as you can out of it. I mean, I didn't go to a residency, but I just feel it must feel so good to get out of residency and feel confident in fellowship, or get out of fellowship and just feel confident in the field. So,
Yeah.
yeah,
Not
great
everyone
pieces
is
of
that.
advice.
And not just in podiatry. Like we had 700 residents at our hospital. Like I tons of other specialties. They also get out, and no matter what, it's gonna be a little nerve wracking. But you want to have built the foundation where okay, it's nervous because I'm alone, but it's fine. Like I'm trained well enough. It's
Yeah,
fine.
right. You've had enough experience, been in enough surgeries. You're good.
Yeah.
Awesome. Well, that actually wraps it up for me. And if there's anything else you want to talk about,
Well, if anyone ever has questions, like I try to respond to things. So they're always welcome to ask me things. I'll be honest. I only have my own experiences, but I'll be honest with like as much as I can with like how my
cool.
residency was and how my fellowship is and like job offers and what I see the career field doing.
Awesome. And where can our viewers and listeners find you on social media?
TikTok, I'm the dancing foot doc, and then Instagram, I'm the Vesely. So just like the letter
Okay.
V and then my last name.
Cool. Awesome. Well, thank you so much for taking time out of your very busy schedule
Yeah,
to
thank
do this
you.
episode. Hopefully, we can meet in person someday.
Yeah,
Let me know if you're
yeah.
ever in New York.
I will. Same with you in Las Vegas.
Well, good luck with everything.
Yeah, thank you so much.
I'll see you on TikTok. Bye.